want you to, it's almost impossible to discuss one without the other. So I want you to turn at the very beginning of this packet that you're in. And it says a couple pages in, you're on the right one right there, your health. There is nothing better in this entire packet to help you understand what happens with chronic cardio and the doggone peripheral vascular peripheral artery disease. Now you got to do a couple things, and this is hard for students to remember. You got to remember that there's more than one way to say the same damn thing. If you're like me, you're sick of it already. Call it one or the other, quit overlapping them. These are exactly the same. Don't say, oh, PVD is peripheral venous disease. No, it's not. Oh, no, it's not. PVD is exactly the same thing, peripheral vascular disease, as peripheral artery disease. That is a big mistake if you don't get that right, because it's on NCLEX again. When you get to NCLEX, you're going to see it again, so you must learn it now. PVD and PAD are the same exact thing. If I want to say something about veins, we don't use these initials. We say venous insufficiency or intermittent, whatever. We say venous insufficiency more than anything else, okay? So every time I talk at this point, I'm talking about arteries. PVD/PAD, we might as well get it over with. Might as well give you a select all on it, because it is really easy to understand. If you continue to remember the story I told, which was that the left side of the heart, aorta, ventricles, was supposed to supply the body with blood in every artery from the toes to the nose. Now, we agreed blood was warm. This patient's got cool extremities. We agreed that this patient with blood being red wouldn't have any color. So this would be pallor or cyanosis. We're embarking, hopefully, on a beautiful summer. We're in the midst of spring. Grass doesn't grow without water. Neither does hair on your body. Hair doesn't grow without circulation of blood. So this patient has hairless extremities. Hairless extremities. They have painful ulcers. Painful ulcers. Arterial conditions really hurt. Painful ulcers. When they dangle their feet, they turn red. So they get the blood down there, don't they? So now they're kind of rubor. That's the word on the test, rubor. We tell this patient, never cross your legs. Don't wear Ted hose ever, or any other restrictive clothing. We tell this patient to dangle before standing up. Dangle before they stand up. Exercise more. And we tell this patient to keep themselves warm. What does cold do? Vasoconstriction. Warm is going to vasodilate. Examples of peripheral vascular / peripheral artery disease, examples of those includes intermittent claudication, Beurgers disease, Raynauds, these were examples. Examples of PVD, PAD. Intermittent claudication, Beurgers and Raynauds. So intermittent claudication, Beurgers and Raynauds, those are all arteries. Beurgers is actually veins and arteries, but it started off as an arterial issue. The cause of all of this atherosclerosis and smoking. Did those work on afterload or preload? Now you're jamming. You agree, baby girl? Okay. So you're jamming because what we said afterload was? Resistance and vasoconstriction. Okay? So this is always an afterload issue. Now, I have a nice little holy hookup for you. It's called, and it's up here, highlight. If we keep whistling Dixie about atherosclerosis, then you better believe you have to probably know those labs. So highlight is basically my mnemonic way of teaching you how to never forget these labs as long as you live. This T, and we work our way back, this T is total cholesterol. This T is triglycerides, which equals stroke, basically, and diabetes. This L is low down, dirty dog, LDL, low down. And this H is happy when high, or HDL. I do want you to make sure you wrote happy when high. I ain't talking about no reefer, but it's happy when it's high. Everything else is happy when it's low, okay? Now, most of you came in here understanding that the total cholesterol should be lower than what big number? Lower than 200. Keep it rounded off. So cholesterol total should be lower than 200. Agree? Someone agree with that? Okay. Now watch this. Let's do our 200, because this is with our holy hookup right here. Lower than 200 and go down by 50 each time. Lower than 150. Lower than 100, but higher than 50. But you can see I went down by 50 each time. 200, 150, 150. Just go down by 50 each time, and you'll never forget these labs that I learned way back at Ursuline, okay, in the 80s. So, happy when high. If you don't remember I said that, it's going to mess you up talking about lower than 50. No, HDL need to be high. HDL is affected by exercise. The more you exercise, the higher your HDL. Statins, those drugs, work on LDL. They lower the LDL, they increase the HDL. Statins. Statins work on afterload. You just said that. If I look at a really bad cholesterol, a really bad triglyceride, a really bad LDL, although I don't need all of those to be bad, and a bad HDL, I don't need all of them to be bad, just need a couple of them to be bad. It's called atherosclerosis. So all this language is important that you know how to sort it out. When I say that my patient has atherosclerosis, I know what their labs are, and they're bad. This is called a lipid profile or lipid panel. The patient must fast for us to be able to do it. Because if I wanted to make these labs high as hell, I could scramble some eggs and eat them right before the test. That's seriously what people don't think. Oh, I didn't know it's important to not eat. Yeah, because just eggs and sausage will make this freaking ridiculous. Okay, so fasting for 8 to 10 hours before you can get this true look at these labs. Okay, Now, so what does Beurgers disease have that is the most important part for you to take home and remember? Beurgers disease has arteries and veins. This issue is artery and veins. And there are clots in both. Thrombi. Thrombi is clots. There are clots in both the smallest arteries and the smallest veins, occluding circulation to the tissue. You knew that. And why did it happen? Smoking. There has never been a Beurgers patient in my presence or anybody else's presence who didn't smoke. It's guaranteed for Beurgers. Not guaranteed for the rest, but it's guaranteed for Beurgers. Okay? Raynauds, on the other hand, is often associated with autoimmune disease. This type of autoimmune disease that you could see Raynauds with, we'll be talking about Monday, and that would be your scleroderma. Remember that crest? Stupid freaking crest thing you had to learn for scleroderma? Part of it was Raynauds, okay? That was something you had to know. So crest included Raynauds with scleroderma, but Raynauds could be with lupus. Raynauds is usually associated with carpal tunnel. Carpal tunnel. Now remember what happens with Raynauds, which is why you had to understand the left side of the heart, the circulation. We said when you don't get blood to tissue, you might have some pallor. Didn't we say that? And if you just let the shit get ridiculous, it was going to turn into cyanosis, right? It was going to get blue. Oh yeah, you got to know that. Because with Raynauds, what's first? Pallor or white skin. When it gets really bad, what's even worse than that? Cyanotic or blue skin. When you warm it up, how good does it get? Red skin. So white, blue, and red. Pallor, cyanosis, rubor. When you warm them up, they get red. And you know what, you guys? That's true with frostbite too. So if you have a patient, a beloved patient who's out in these elements, homeless guy maybe, they're going to turn white as they start to get frostbite. And then they're going to get blue because there's like no blood to tissue. When you have Beurgers, you can have an amputation. And if you don't treat Raynauds with warming them up, frostbite, you could get amputation. Amputation is number one with Beurgers. Those patients really get themselves into some trouble.